Hi, Dr. Blake. My name is Brianne Horlock, and this is my case study number 2. Here's a 360 of the room. I'm first going to start off by washing my hands. Wiping my stethoscope. And donning gloves. Hi, my name is Brianna. I'm going to examine you as to why you're experiencing ear pain, sore throat, shortness of breath, and limited range of motion of your upper extremities. Is that okay?
Yes.
Before we start, do you need to empty your bladder?
No.
I'm now going to provide the patient with some privacy. I'm now going to state my subjective questions. How long have you had these symptoms for? What is your pain on a scale of 1 to 10? Is your shortness of breath consistent or does it come in episodes? Does your shortness of breath occur at any specific time of day? And do you have any previous muscle or nerve injuries? I'm now going to inspect the ear. Patient's ears are symmetrical and there is no discharge. I'm now going to palpate the patient's auricle and tragus for tenderness. There is no tenderness. I'm now going to perform the whisper test. Could you cover one ear for me, please?
2B4. 7S8.
Patient has successfully repeated the sentences back to me, therefore there is no problems with the whisper test. I'm now going to inspect the patient's nose. Patient's nose is midline. There is no signs of nostril flaring. There is no discharge or any crusting. I'm now going to palpate the patient's sinuses. Frontal, maxillary. Any pain?
Yes.
Patient is experiencing minor pain and pressure. I'm now going to inspect the patient's mouth and pharynx. Patient's lips are symmetrical. They are pink, hydrated. There are no lesions or any swelling. Patient's gums are pink. There's no signs of bleeding. There are no lesions or any swelling. Open your mouth for me, please. Patient's teeth are square. There are no signs of looseness, and they are white and polished. Could you stick your tongue out for me? Patient's tongue is symmetrical, hydrated. There are no lesions, and it is pink. Patient's hard and soft palate are pink, no lesions, and the skin is intact. I'm now going to perform cranial nerve number 9, 10, and 12 test. Could you stick your tongue out for me and say ah?
Ah.
Patient's soft palate rises and the uvula is midline. Therefore, there's no problems with cranial nerve number 9, the glossopharyngeal, and cranial nerve number 10, the vagus. Could you stick your tongue out for me? Put it side to side. Say light, tight, dynamite.
Light, tight, dynamite.
Patient's speech is good and there are no tremors. Therefore, there's no problems with cranial nerve number 12, the hypoglossal. I'm now going to palpate the patient's neck. Any pain?
No.
There are no lesions, no scars. Color is similar to the rest of the body. Temperature is slightly warm. Patient is not in any pain. There's no tenderness and there's no crepitus. I'm now going to palpate the patient's carotid artery. I would hold for 1 minute and hold for 1 minute. Patient's rate is 85 beats per minute. Rhythm is consistent. Grade is +3 and strength is +2. I'm now going to perform cranial nerve number 11 test. Shrug your shoulders, put them down. Shrug against my resistance. Turn your head against my resistance. Patient is unable to hold resistance, therefore there is an issue with cranial nerve number 11, the spinal accessory. I'm now going to inspect the patient's upper extremities. Patient's upper extremities are symmetrical. There are no lesions, no scars. Hair distribution is equal. I'm now going to palpate the patient's upper extremities. Any pain?
No.
Patient's upper extremities. Patient is not in any pain. There's no tenderness, no masses. Temperature is slightly warm. And there's no swelling. Patient's nails are round and there are no lesions. I'm now going to perform the limited range of motion test. Stand up for me. Flexion of the fingers, extension, flexion of the wrist, extension, radial deviation, ulnar deviation, extension of the elbow, flexion,
Ow.
supination, pronation, adduction, abduction, inner rotation, external rotation.
Ow.
Patient is experiencing pain in the elbows and shoulders and is experiencing limited range of motion in the elbows and shoulders. I'm now going to palpate the patient's radial pulses. I would hold for 15 seconds and multiply by 4. Patient's rate is 85 beats per minute. Rhythm is consistent and they are equal on both sides. I'm now going to palpate the patient's brachial pulse. I would hold for 15 seconds and multiply by 4 and do the same on the other side. Patient's rate is 80 beats per minute. Rhythm is consistent and they are equal bilaterally. I'm now going to perform the hand grip test. Could you grip my fingers, please? Okay. Patient's grip is weak, but they are symmetrical on both sides. Could you sit down with your back towards me, please? Patient's thorax is symmetrical. There are no lesions, no swelling, no skeletal deformities. Hair distribution is normal, and there are no noticeable masses. I'm now going to state the patient's anterior, posterior, and transverse ratio. Raise your arm for me, please. Patient's ratio is 1 to 2. I'm now going to inspect the patient's thorax. Palpate the patient's thorax. Any pain?
No.
Could you take a deep breath in for me, please? And out. Patient is not in any pain. There's no tenderness, no masses. Patient has equal chest expansion and temperature is slightly warm. I'm now going to percuss for resonance. 1, 1, 2, 2, 3, 3, 4, 4, 5, 5, 6, 6, 7, 7, 8, 9, 8, 9. Resonant sounds are normal. I'm now going to auscultate for the patient's breath sounds. Deep breath in and out. 1, 1, 2, 2. I would now continue to do this for all 9 places. 3, 3, 4, 4, 5, 5, 6, 6, 7, 7, 8, 9, 8, 9. There is wheezing at the top left lobe. Patient's rate is 24 breaths per minute. Rhythm is irregular. Quality is +2, and there are no other adventitious sounds. That is my case study number 2. Here's a 360 of the room.